Hello and welcome to the Arrivals podcast. I'm your host, Merelise Wilson, and I have my good friend Leah here today with me. Hi.
Hi, good to be here.
I'm so excited that you're joining me. You are, 12 weeks postpartum?
Just about, maybe 13. 13 today, actually.
Oh, wow. So you are definitely the most recently postpartum guest I've had so far. So I'm excited to talk to you. It's going to be very fresh.
Yes, it feels a little funny to even be here talking about my birth story because I feel like I'm still in it.
Yeah, that's fair. That's very fair. Well, I'm very thankful that you're giving your time up, especially when you have such a little baby, to be here and to talk. So let's dig in.
Yeah.
Where do you want to start?
Well, I do want to say that for those of you listening out there, I know a lot of your listeners are probably pregnant mamas to be. And I know as a first-time mom, a lot of the content that I listened to was really informative and helpful, but some of it was a little scary when you heard some of the things that can happen. And my story does include some scary things, but I think that the best part of it is that I'm here. I'm here today. I'm 13 weeks postpartum and I'm healthy and my son is healthy. And so that's the bright light in all of this. And that's what makes this story and makes birth so awesome.
Yes. Yeah. I think it's so important to talk about every type of birth story, not only for people who can learn from them, but I have found personally that talking about my birth stories, some of the not so great parts of them have been really healing for me. I think I didn't even realize really at the time that I think I had a little bit of PTSD, or maybe not that extreme, but I think I did have some trauma or some sadness around my birth with Kit that I didn't really realize until later on. And I think talking through it has really helped me. So I hope you feel that way too.
Absolutely. And I don't think that PTSD is a dramatic word to use. And I have been in therapy for years and years, and luckily have had such a good relationship with my therapist to help me even through some of this, because there are elements of PTSD from my story too. And I think that that's something that's probably under acknowledged in the birth space, because as beautiful and amazing as it is and empowering, it's also can be traumatic.
Yeah.
And so, it's something to definitely work through, but I feel really cool about it now. So
good. I was going to say too, I think a lot of times when the end result is a healthy mom and a healthy baby, a lot of times I think we feel pushed to kind of sweep the bad parts under the rug, and just focus on, well, everything's okay because like it could have been worse. But I still think every part of our individual stories are important to acknowledge, and it can be really heavy. So.
Yeah. Well, that being said, I think that in order to tell my birth story with my son, I feel like it would help to give some context to how I got here. And so those close to me have heard me say this, that I feel like I've been pregnant for 2 years because in a way I was. So my journey of trying to get pregnant started in 2024. I was married in 2023 and wanted to get started right away. And I was lucky enough to get pregnant very quickly. And in the summer of 2024, I did get pregnant and was honestly pretty shell-shocked.
That was quick.
Yeah, here we go. And early on in that pregnancy, I was having some bleeding. And if anyone listening is pregnant, has been pregnant, they know that that can be very normal. And that's what everybody kept telling me, was that it was normal. But something in my gut just really told me it wasn't. And, Merelise, you know me pretty well, that like I've approached pregnancy with a lot of just like, come what may, and it'll be fine and it'll be great. But I didn't think I had a whole lot of intuition around it, I guess is what I'm trying to say. But in that pregnancy, something felt wrong and it didn't feel normal. And so I went to the doctor and I told them that. I said, I just don't feel right about this. And so they said, okay, normally you wait a good amount of time in that first trimester before your first scan. But because of the bleeding that I was having, they said, all right, well, why don't you come on in? And we had we did some tests and we did some scans. And that was when they discovered at 7 weeks that my embryo had implanted in my right fallopian tube,
Mm-hmm.
which is an ectopic pregnancy.
Mm-hmm.
And unfortunately, ectopic pregnancies, there is no saving them. There's no
Mm-hmm.
moving them. There's no recovering them. They'll grow and grow in the wrong place until eventually they can rupture and obviously terminate the pregnancy, but could potentially harm the mother.
Yeah.
And so it's imperative to end it pretty quickly.
Yeah. To diagnose it and to end it. Yeah.
Mm-hmm. And so, that was the first moment in this whole journey where I was like, wow, I'm in charge of advocating for myself, and also not just advocating, but like knowing, reporting. And it felt like an immense pressure to be like, okay, I got to be the one to like make sure I say something.
Yeah.
Because had I not, who knows what could have happened. So, that really kicked everything off for me and really gave me a different perspective on how to approach pregnancy. We obviously had to terminate that pregnancy and I had to recover before I could try again, which felt like a million years.
Yeah.
It was like 3 months.
Yeah.
And luckily I was able to get pregnant again, honestly, pretty quickly after that. And so, of course, those first few weeks of my second pregnancy were nerve-wracking, watching every symptom. Does this feel the same? Does this feel the same? Does that look the same? And, spoiler alert, I had bleeding again. And this time it was normal.
Yeah.
And so, when the doctors say that's normal, it really can
Sometimes
be.
it can be. Yeah, I know.
But, when we got that first acknowledgement that the embryo had implanted in my uterus, it was like the coolest day ever.
Yeah.
I was like, all right, we did it.
Oh.
But that excitement and that like joy of this is going to be a normal pregnancy was like quite short-lived.
Yeah. So were you kind of marked as like high risk, or not necessarily high risk, but as did you have any sort of special marker on your pregnancy because of your prior ectopic pregnancy?
Yeah, I'm glad that you asked that. The odds of a woman having an ectopic pregnancy, which doesn't have to be in the fallopian tube. It can be anywhere it's not supposed to be. It can implant in C-section scar tissue, fallopian tubes. I've heard some crazy stories of where all embryos can implant, but the odds of that happening to a woman is about 2%.
Yeah.
That number increases to 10% if you've had one.
Wow.
So yes, I was considered a high-risk pregnancy for the beginning of my second pregnancy. And I was able to come in very quickly for early scans, early blood work to make sure that my HCG levels were rising appropriately because of those odds.
Yeah.
So there was a period where they moved me out of the high-risk pregnancy bucket. They were like, all right, you're a normal pregnancy. Everything looks good. And we were on cloud 9. We got the blood work done at 10 weeks, that everything was genetically healthy and got the gender result. Then we reached the 12-week checkup. And that's when we were sort of put back into the high risk category. And that was because of my blood pressure. And so my blood pressure has always been sort of a thing. I've always had borderline high blood pressure. It runs in my family. And it's just something that the doctors that I've seen in the past have always flagged as, let's keep an eye on it.
Yeah.
And for those listening, a normal blood pressure is 140/90. And anything above that is considered high blood pressure. Ideally, you're lower than that. That's just the line of where it is high. And I was always sitting right at that line.
And I remember you had mentioned too that there was some like speculation, maybe it was just white coat syndrome. Because, when you're a young woman, you go to the doctor maybe once a year, maybe twice a year. And so if you're only getting your blood pressure taken, a couple of times a year, and it's only in an office hospital doctor like setting, and it's on the line, I could see how they might write it off as white coat syndrome or just nerves.
Yeah. And I think the fact that I do have a history of anxiety was one of the things that many of my doctors used to write it off. And I don't want to say used in a negative light. It is a real thing.
Yeah.
And, it's funny, actually, the place I got my blood pressure taken the most is the dentist. And I hate going to the dentist. And so it's very real. So yeah, I was like, maybe it is that. But the one thing that every doctor I saw said was, you're young and you're healthy. This won't be a problem until you get pregnant.
Mm-hmm.
And it was true. At my 12-week appointment, that was the first time my OB talked to us about preeclampsia.
Mm-hmm.
And preeclampsia is a really complicated condition. I've heard it called condition. I've heard it called disease by some of the doctors too. But essentially, it is diagnosed by a few markers, one being high blood pressure, another being protein in your urine. And so from that point forward, they were really watching my kidneys
Mm-hmm.
by watching my urine samples and testing for proteins. And that was honestly so early. It was like such an early thing to be like, oh, already I'm.
A lot of people barely even know they're pregnant at 12 weeks.
Right. And the first test that I had to do, which I ended up having to do maybe 4 or 5 of them, was a 24-hour urine sample, which is about as fun as it sounds. Really, from that point forward, my second trimester was filled with blood pressure logs and urine samples and doctor's visits, just really trying to watch it, which I was really glad of how vigilant my OB was being about all of this. And when I say that my blood pressure has always been borderline, I feel like borderline is a really good word for how I was through that whole second trimester.
Yeah.
They kept saying, well, you don't have preeclampsia yet. You're just borderline.
Mm-hmm.
And, part of me is grateful that I had all that time. I had that time for my son to grow, and I had that time to be a relatively healthy pregnant person. I was active, playing tennis still. But the other part of me is like, just diagnose me already.
Yeah.
If it's going to happen.
The unknown or the what ifs or a lot of times that can be even harder than a diagnosis. And so if they had diagnosed you sooner in your pregnancy, would you have changed anything?
I think that probably the only thing that would have changed would have been potentially changed my birth plan.
Yeah.
And I don't know that to be fact. Mm-hmm. That's just one of the things that I've thought about, is if I had had an earlier diagnosis, would it have impacted the choices that we made leading up to birth?
I could see that.
That said, I think that another thing that it might have changed, and I don't think it necessarily required a diagnosis for this part to change, but I would have maybe done a little bit more research on what my options were.
Yeah.
I'll be honest, even when I knew it was a possibility, I was afraid of learning about it. I was scared. I was scared of what the implications of preeclampsia were. And I didn't want to scare myself. I was already pregnant.
Yeah. You'd already been through a scary experience.
Yeah. And I think that, the internet can be a scary place. And
certainly.
Every time I would even remotely watch a video on TikTok about preeclampsia, I would start to get so nervous. And I would think, well, don't manifest something that's not true yet.
Yeah.
Obviously, in hindsight, I did have it. And so I could have been taking that time to learn, but I was afraid that I was going to manifest a diagnosis that I would eventually skate by.
Right.
And I didn't want to worry before I had to, if that makes any sense.
It does. It's very relatable.
But had I gotten that diagnosis and I hadn't been tiptoeing around it, maybe I could have been armed with more information and I could have been prepared for what was to come, which we can get into.
Yeah.
So yeah, when like I said, my second trimester was a series of tests and medications for my blood pressure. Essentially, they were describing it as chasing it. They were just constantly chasing my blood pressure, trying to keep it under control with medication. And they just kept increasing my dose. And
you had some bad reactions. Like you had to try a couple different types of medication, right?
Right. Yes. I tried one medication first, which is the first line of defense for most pregnant women with high blood pressure, because medications, as most people know, are sketchy around pregnancy because a lot of pregnancy drugs and things that people need to take during pregnancy, there's not a lot of information around what's safe.
Yeah, no one wants to volunteer and say, hey, I'm pregnant. I'll take this mystery drug and see if it has a negative impact.
Correct. But they gave me, the most commonly known to work well with pregnancy and high blood pressure drug. And I instantly had a migraine, and I was like,
we got to try something else.
Yeah. But we were really handling it, and it felt like we were just, one doctor's visit at a time. And I was really trying to remain calm. I think that was the main thing throughout that whole second trimester, was just, they'll tell me when to worry. And that time came pretty early into my third trimester. So I was around 33 weeks, and I'll never forget, I was at the OB, and it was for one of my appointments that my husband couldn't go to with me. And I was really grateful that he came to pretty much every appointment with me, because I was often getting scary news. And I was like, I can't do these by myself. But there was one appointment where I was like, it's going to be an in and out. It's going to be a quick appointment. And it was with, hopefully she's not listening, but I won't say her name, but my practice had multiple OBs, and we cycled through all of them. And there was one of the OBs we just did not jive.
There's always one in every practice.
Yeah. And she was, there's nothing wrong with her competency. She just, her bedside manner was not one that jives well with mine.
She was not your style.
No.
Type.
And I was with her, and she was looking at my numbers. And like I said, I was 33 weeks. And she very bluntly said, I don't like these numbers, and I don't know why others in the practice haven't diagnosed you with preeclampsia yet. And I thought, okay, is that your way of saying I do have it? She said, well, it's hard to say without a couple more tests, but I don't think you're going to have this baby in your belly for much longer. I think you'll probably have this baby next week.
You're like, what?
Come again? And again, I'm alone. I was like, oh, okay.
Yeah. So now you're telling me in one breath that I have preeclampsia, and now I'm potentially dealing with a, early birth and delivery. And
I was like, I have 7 weeks to go, lady.
Yeah. This was not on my bingo card.
No. And I was like, there's no way.
That's right. Second opinion. Let's get a second opinion in here.
And I was like, so I'm going to go the weekend. That was on a Thursday. And I was like, I'm going to go the weekend, and I'm just going to chill and I'm going to relax. And they asked me to come in on Monday to get an ultrasound. So I just spent the weekend really just holding it against that doctor.
Yeah.
And being like, it'll be fine. And up until then, the biggest blessing of all of this was that my baby was fine. Every test, every ultrasound, he was measuring great. He had actually, even at this point, flipped to head down.
Yeah.
And so that was such a reassurance for me, is I thought I can handle whatever gets thrown my way as long as he's okay.
Right.
That sort of changed on the following Monday when I went in for that ultrasound. We went in, and thank God I brought my husband that time. I was like, you are coming with me.
You're sticking with me, buddy, from here on out.
And they did the ultrasound, and for the first time, the measurements of my son's abdomen were off. And that, when I mentioned that there are a few markers for preeclampsia, that is a third one, is the abdomen circumference of the baby. If it's low,
the abdomen. Okay.
If it's low, that means that he's not getting enough oxygen, nutrients, and that could be because of my blood pressure. And it's called intrauterine growth restriction, IUGR. So that was what they were assuming on Monday after that ultrasound. And that required a visit to a maternal fetal specialist. Yeah. Now, they did tell me that most OBs have a pretty simple system for their ultrasound technology. It's very rudimentary. I mean, it's way cooler than it used to be.
Right. But there's still a lot of room for error or interpretation.
Yeah. It's, there's more high tech systems out there now that most typical OBs don't have, but maternal fetal specialists do. So they said we could be just seeing this wrong. Yeah. He could be in a weird position. So we want you to get checked by someone with higher technology.
Yeah.
And so that's what we did. We had an appointment that next morning. It was a Tuesday. And so, again, my intuition that I was talking about earlier, where like in my first pregnancy, and I thought something doesn't feel right.
Yeah.
That Monday night, I packed my hospital bag.
Yeah.
And I was like, I just feel like I should have some stuff ready.
Yeah.
And at this point, my husband and I hadn't even come up with a name for the baby yet. And I was like, can we maybe get a short list in case I have this baby at some point? And, my husband is the opposite of an alarmist. He was like, you're going to be fine. We're just going to go to the doctor and everything's going to be fine.
Yeah.
We went to the doctor the next morning, and as always, they took your blood pressure the minute you walk in. Of course, mine was high. And they said, all right, well, we're going to do the ultrasound and we're going to check everything out. And then we're going to take your blood pressure again after you've been laying down for a little while. I was also nervous.
Yeah.
I had just gotten pretty scary news the day before. And so I was like, maybe that's why it's high. But spoiler alert, also, if you have high blood pressure, you either have it or you don't.
Yeah.
Nerves start to be a non-issue.
Yeah.
It's like I could be in a bathtub chilling and it was high.
And you had at that point, or probably earlier on, you'd start taking your blood pressure regularly at home during your pregnancy.
Yes.
So it was no longer, you were not only relying on doctors to check it, so you were monitoring it at home as well.
Yeah. And that was important to be able to know if it was nerves.
Right.
Or if it was white coat syndrome, or if it was walking through the parking deck. A lot of my knowledge around that at that point was what's normal for me.
Yeah.
Yeah, we bought a blood pressure cuff on the way to our baby moon.
How romantic.
Yeah. We did the ultrasound, and the ultrasound tech at the maternal fetal specialist was awesome. She was just so reassuring and so great and cheerful and really put us at ease. And immediately she said, everything looks fine.
Oh,
the baby's abdomen is measuring absolutely normal. I mean, it was like a good bit off from the measurements from the day before. And so a part of me was sort of peeved. I was like, man, I was worried for like 24 hours about this thing that's now a nothing burger.
Right.
But we were happy, and just like, good news is
we'll take it.
We'll take it at this point. And so we're laying there. I'm laying there on the table where they've just taken my scans. And the nurse came in and she took my blood pressure manually, because sometimes the machines are also a little bit off. It's funny the things you learn. I'm like, is any of this reliable?
Right.
But the good news is, there's always good old fashioned old medicine, and they know how to take it manually. And the nurse came in at that point. She took my blood pressure and she gave a face. And I was like, not good. When you're someone with high blood pressure, you're like, what is it? Tell me.
You're like, let's hear it.
Yeah. And she said, I'm going to take it on your other arm and I'm going to see if maybe this was just a fluke. Try and relax when someone says that.
Yeah.
But she takes it on my other arm and she said, okay, it was the same. I'm going to go get the doctor. So she steps out and she goes and gets the doctor, and she comes in and she said, your blood pressure is 170 over 111. You need to go to the hospital.
Yeah. Was that the highest you had measured since you've been pregnant?
That was the highest ever, any measurement at home.
Yeah.
I had some pretty scary numbers at home, but nothing like that. So she said, we're going to wheel you across the street and you're going to go straight to the hospital. I didn't even know that there was a way to get to, we were just at a different doctor's office near the campus, and we went underground in a tunnel.
Oh, wow. I don't remember this part of your story.
Yeah, it was funny. They had a plan, and they took me across the street, and I got checked in to labor and delivery. And at this point I was like, I have dirty dishes in the sink at home. Like,
I remember you were texting us and you were like, we're checking into the hospital. And we were like, but surely this isn't it, like this is not. And to your credit, like you said, that you really had just been kind of throughout your whole pregnancy, like, well, we'll just wait and see. We'll wait and see. I think as your friends, like, we really didn't expect it to escalate to this level either.
Yeah.
Like you'd definitely given off this like very calm, not worried about it kind of approach throughout your whole pregnancy. So yeah, it was quite shocking to everyone.
Yeah. And I think that that's that's feedback I've gotten from family
Yeah.
too. And I think that I was worried through a lot of my pregnancy, but I didn't see the harm, or I didn't see the benefit in worrying everyone else.
Yeah.
But also, the more others worry about me, the more I worry about myself.
Yeah. Yeah.
So it was really selfish in nature, being like, I'm just not going to let anybody be worried.
Yeah.
This is all going to be fine.
Yeah.
Hakuna Matata. And even in that moment, I was hopeful that I would get to go home.
Mm-hmm. I remember that. Yeah.
You know, they said, we're going to check you in. We're going to run some tests. And hopefully, if your blood pressure is able to be managed, you can go home.
Mm-hmm.
Because really, at this point, the number that they kept throwing out to me was 37 weeks.
Mm-hmm.
You know, we hear over and over again that 40 weeks is full term.
Right.
Something that I found interesting is how many doctors referred to 37 weeks as full term. And I think that is in regards to important organ development in the baby.
Yeah.
By the end of the 36th and 37th week, the lungs are developed. Really, those primary functions of the baby that are needed for survival are baked.
Yeah.
And so I guess those last 3 weeks are just icing. And so the goal at that point was just to keep me pregnant and keep me healthy.
Yeah.
And keep the baby healthy.
Yeah.
And I get checked in, and it was just settle in for a couple of days of monitoring.
Yeah. Which, I mean, you just said that really casually, but I remember when you told us, it was like, wait, you're going to have to stay in the hospital for days?
Yeah. I mean, as someone who I don't think I've ever stayed in a hospital overnight, but they were like, I kept getting conflicting reports for how long I would be there. And I think that in hindsight, no one knew.
Yeah.
And so really a lot of the information in the storytelling that I get to give now, the gift of the perspective of hindsight, is so nice because I was learning everything so slowly.
Yeah.
Hours of just sitting and waiting for one doctor after another to come in and tell me what they were going to test next. But the one thing that they were really clear on from the beginning was that the numbers of my blood pressure that they were seeing were not numbers that they were comfortable sending me home with.
Yeah.
And so they said that as long as my blood pressure readings were that high, I was in there. And they told me about something called a hydralazine protocol.
Mm-hmm.
I feel like at the end of a lot of this, I was like, did I go to med school?
Yeah, I know. I'm very impressed.
Everyone listening who did go to med school, I apologize because I definitely didn't. But some of the things that I was learning, I was like, wow, I've never heard of this. They have something called a hydralazine protocol, which was an IV medication for blood pressure.
Yeah.
So instantly when I was admitted to the hospital, I was given an IV port in case this protocol were to be initiated at any point. And it really was for the management of super high numbers.
Yeah.
A lot of the management we were doing was through oral medication, but the IV medication would just obviously work a lot faster.
Yeah.
But yeah, so they put that IV port in sort of prophylactically, I think is the word, like just in case.
Yeah.
But we spent a couple of days of just, monitoring my blood pressure, monitoring my urine for protein, which eventually that was high as well. So I had 2 out of 3 markers of preeclampsia at this point. But again, no one's saying you have it. But there was one point in this stay where one of the doctors came in, and of course my husband was not in the room again. Like this was there were so few times where he wasn't in the room, and it seemed to always be when somebody important came in.
Yep.
But one of my OBs came in, and she said something about my test results from that morning. And she was like, well, we're going to see what they look like tomorrow morning. And I thought, another night?
Right.
Like even at that point, I was like thinking I could go home.
Yeah.
And I said, what do you mean tomorrow morning? Do I have to stay again tonight? And she said, oh, has no one told you? You're not leaving this hospital without a baby. Again.
Yeah.
Bedside manner. Could use some
Yes.
work. And I started sobbing.
Yes.
I was like, I'm 33 weeks pregnant.
Right.
I have to be here until I'm at least 36 weeks pregnant. That's forever.
Right, that's forever. So either you're going to be in the hospital forever or you're going to give birth early, and neither one is something that you wanted.
Yeah. And again, I'm like, I had dishes in the sink.
Yeah.
I was like, I guess this is what women who go in, whose water breaks at a restaurant, they experience. But like, I just felt so unprepared to be there for the long haul.
Yeah.
I felt caught off guard.
Yeah.
And luckily I had one of my OBs come in and talk to me and my husband at like the next day. I think it was a Thursday. So this is one full week from that appointment where the doctor said, you're going to have this baby next week. Yeah. But I had one of the OBs come in and I said, can you just tell me what's going on? Yeah. Like what should I expect? And he said, preeclampsia is something that once you have it, you have it. And once it's bad, there's no going back.
Right.
And so that's why they weren't comfortable sending me home, because it can escalate within minutes.
Right.
And he said, if we sent you home, even if you were monitoring your blood pressure at home, the time it would take you to come back to the hospital, get readmitted into a room, all of these things could be really dangerous minutes.
And not to cause anyone alarm, but can you talk a little bit about what the risks are? Like what the worst outcome would be?
Yes. So essentially, preeclampsia, the only treatment is delivery of the placenta. The placenta is a new organ that's essentially, putting a strain on your system that pumps blood through your body, and it's getting blood pumped through it. And with high blood pressure, my heart muscle is just working really hard to pump that blood through my body. And again, apologies to any medical professionals out there. This is layman's terms and this is the best I can do. But the real risk at this point was for the blood to be pumping so inefficiently through my body that I were to have a seizure and potentially a stroke.
Right.
And so that's why it was imperative that I be in the hospital in case that were to become something that could happen. And like I explained earlier, the IV port that I had in my hand was in place for that reason.
Yeah, so they could get medicine into you quickly if that were the case.
Like they don't even have time to want to put in a port. And when he told me this, he said, this could happen in 2 weeks. This could happen tonight. Yeah. We just don't know. Yeah. And so he left that discussion really giving me some tips on how to not go crazy in 2 weeks in the hospital. He was talking about getting me permission to go outside. He was talking to me about having visitors, things like that. Well, that night I was on the phone with my sister telling her this update and feeling fine. I was really trying to keep a positive attitude about being in there. And I hung up the phone and the nurse came in for my final blood pressure check of the night before I went to sleep. And she took my blood pressure and it was high. Can't remember the exact number, but it was a number that they're required to take it again 15 minutes later.
Yeah.
So she takes it and says, okay, well, I'll be back in 15 minutes and I'm going to take it again. Okay. And if it's high again, I will have to initiate the hydralazine protocol. And she came back in and it was even higher. And so they immediately, this is around midnight, they immediately administer the IV medication to bring my blood pressure down. And they kept a cuff on my arm and they said, this cuff is going to take your blood pressure every 15 minutes for a couple of hours. I am sitting there in the bed and every few minutes it's just going off. And I'm trying to sleep in between, but it was hard. And my blood pressure was just not going anywhere. It wasn't budging. And my husband was watching the whole thing while I was trying to rest. He was pretty much awake through the whole experience. And every time they would do another, I think, hour check, they would have to give me more hydralazine through my IV. And they continued in this manner for hours. Yeah. And it just my blood pressure just never came down. And so it had been so interesting that the doctor had said it could happen in 2 weeks. It could happen tonight because it did happen that night. And even while it was happening, I didn't think it's happening. Right. Right. I just was like, this is just another thing.
Yeah. It'll go down. Like, well,
it'll be fine. But the next morning rounds began and I was waiting on the OB to come through, and she did. And she came through, and full circle moment, the OB that I had only seen once, and I'd seen her at my 12-week appointment.
Oh,
she was the
wow.
first doctor to tell me about preeclampsia.
Wow.
And she came in and she said, "Hey, Leah, we are going to have to induce you today."
Mm-hmm.
And I just almost like glazed over. I was like, no.
Surely not. That's not what that doesn't mean what I think it means.
Yeah. And at this point I had passed the 34-week mark, and 34 weeks was another benchmark that they were sort of hoping to get to. Something I didn't mention that they did immediately when I was admitted into the hospital was they gave me 2 steroid shots to help the baby's lungs finish developing.
Right.
Because in the off chance that I were to deliver before 37 weeks, they wanted to make sure that his lungs were finished growing.
And that's oftentimes what keeps preemies in the hospital.
Yes.
That's kind of like the last thing. Mm-hmm.
Which, to me is a little weird that that's towards the end. I think there's a little flaw in the design. There.
I know, right?
Can't we be finishing up the fingernails at that point? Like, why are we finishing the lungs?
Yes, so true.
Feels like those should have happened maybe in the second trimester. But
who can we talk to about that?
Yeah. Yeah, they gave me some steroid shots for that. And so they were really hoping to get to 37 weeks, but 34 weeks was like the bare minimum in their eyes. And I had gotten there, and I had reached the point of no return with my blood pressure where they just no longer felt comfortable keeping me pregnant for the risk of all the things I talked about before with the stroke and seizures. So she said, "We're going to induce you. We're going to move rooms, and we're going to do it pretty quickly." Yeah. The woman in me, the vain moment, I said, "Ma'am, I haven't showered since I left my house on Tuesday morning." Yeah. And I don't even know if I showered that morning. And so I was like, "Can I take a shower? Like, I don't want to have not bathed after, like, you're going to have a baby and you're going to go through all of this." I was like, "Can I shower and
your
wash
whole
my
world's
hair
about to change, or
and
like
eat something maybe?" And she said,
probably no to the
eating for potential of surgery.
Right.
Because C-section was on the table. It was not a guarantee at this point, but it was on the table. So no to the eating. I think I was able to have like a banana,
and for those who don't know, that there's risk of aspiration when you are under general anesthesia. And if you have food in your stomach, it's a higher risk.
Yeah. And so it's another just in case, which I get it. But it's crappy.
Yeah, it's really annoying.
She said, "Okay, you can shower, but make it quick. It's going to be about an hour." So she leaves the room, and I'm like
jumping out of bed.
I'm Tasmanian devil. I'm like showering, blow drying my hair. I called my parents. I was so rude to them. I was like, "I'm having the baby today. Bye."
Oh, God.
And
I can't imagine.
I cut them off. They were probably so nervous, and I know that they were nervous. And I was just like, "No time to talk. Gotta blow dry my hair."
Yeah.
And then we proceeded to sit there for 4 hours.
I know. Hurry up and wait. I feel like this is a good moment to kind of pause. And I wanted to ask you, before all of this happened, when you found out you were pregnant and like as your pregnancy was progressing, did you have a birth plan? Or I always like to say birth preferences, because plans, there's no such thing as plans when it comes to babies being born. But I do think that there are preferences. And so I'm just curious, did you have kind of a list of preferences? Had you gone down that path? Obviously it's something that I'm super passionate about. And I remember really trying to like give you your space during your pregnancy and not push it on you. I figured you would come talk to me about it if you wanted to, but I'm just curious, had this all kind of like not taken a left turn? Were there things that you wanted and didn't want, or you know what I mean?
Yes. And I know you've already mentioned it on this podcast. You gave me a book, The Positive Birth
Book.
Yes. Yeah. And I had looked through it, and I believe it was that book that had a section about birth preferences. And it was sort of like a checklist, if you will, of like, do you want delayed cord cutting, or do you want them to cut it immediately? And I think it was this book that had it, like either or choices.
Yeah, it was really straightforward and helpful, I remember.
Yeah, and even had like worksheets and like symbols to choose from, so you could sort of make your own worksheet. Yeah, I think maybe even online you could like go out and like
print it and
print it yourself. Yeah, which I hadn't gone so far as to do that, but I had started to make notes of what I wanted and what I didn't want, luckily. So thank you for that.
Oh, good. I'm glad it helped.
So yes, I had essentially started to think about some things that I had preferences for. And the biggest thing in this instance that I had said pretty much for a long time in my pregnancy was, I am not anti C-section. I am not afraid of it. I'm not willing to put my health at risk to avoid it.
Yeah.
I was trying to be very clear with the doctors that I wasn't advocating for it. I just didn't want them to put me at risk in order to give me a vaginal birth that I didn't necessarily need.
Right. Well, and it's funny. I remember even when we were like in college, and we were college roommates, that's our friendship origin story. But even when we were in college, for some reason, we were talking about maybe it was when your sister was having her first baby or something. But I remember you kind of had wondered out loud if you were going to end up having a C-section because your mom had C-sections and you have like pretty narrow hips and stuff. And
I'd even had doctors tell me I was going to have.
Yes, exactly. And so I feel like that it was always something that was kind of on your radar. And I feel like maybe it was helpful to kind of set the stage early on for like a level of acceptance about it. You know?
Yeah. I think, the same could even be said for like breastfeeding for me. I was like, if it works, great.
Yeah.
If it doesn't, I'm not going to stress about it.
Yeah.
Same with vaginal birth. I was like, if it's something that I can do, great. If it doesn't work, I'm not going to stress about it.
Right.
There's so many things that happen in pregnancy and birth that you can't control.
Yeah.
But I do think that it is worth mentioning, like you said, there are things that you can control, or you can at least speak up and advocate about. And I was very lax for a long time about that. I was like, I don't care.
Yeah.
And, I didn't go to med school. I don't need to know. I feel differently about that now. I think that if anything, it did empower me to learn more about what your options are, mostly because they do ask you.
Yeah.
There was a lot about birth and labor that I thought that they would just tell me.
Yeah.
And they asked me, do you want this? Do you want that? And you got to be prepared with an answer.
Yeah.
So at this point, they were inducing me and we were in that mad dash to get to the room. The mad dash, I'm using air quotes because it was 4 hours of just sitting there.
Classic.
But we ended up getting a room and they walked me through what the induction was going to look like from that point forward.
Were you dilated at all? I assume no, considering you were 34 weeks.
That's a good question. So they did say we're going to have to do a cervical check before we get started on any drugs just to see where we're at.
Right.
And I was, I think, like 1 centimeter dilated, which I guess is normal for 34 weeks. So they said, we're going to first start with a drug called Cytotec, which is a cervical softener. Yeah. It's an oral tablet that is a dissolve on the tongue tablet, but someone forgot to tell the tablet because it tastes like you're eating a receipt. It's the grossest thing ever. Oh. And I had to take one like every couple of hours for 24 hours. It was like, can we find a different way for this drug to get into my body? But something that they very lightly told me in this moment when I'm checking in to get started with everything was, because you have preeclampsia, we have to put you on an IV drip of a medication called magnesium. And for everyone listening, this is not the magnesium you take to go to sleep. No. And this magnesium drip, which I will not lovingly refer to probably throughout the rest of this as the mag drip, is meant to essentially dilate your blood vessels and open them up so that the blood can flow more freely. And this is designed to help prevent seizures that would cause a stroke. And so they told me you need to be on this mag drip for the entire experience, the entire induction, essentially because my blood pressure at any point could get so high that I could have a stroke. And they wanted to prevent that from happening. So when they told me I had to be on this magnesium drip for 24 hours, or at least during the induction, they said, you're going to feel crummy. It's going to feel like flu-like symptoms. And if you've learned anything ever from being around doctors, when they say something's going to hurt or it's going to be unpleasant, they say you're going to feel pressure. Right. And if they say you're going to feel crummy, just picture worst feeling imaginable.
Right. Right.
I just have found in my experience, they always downplay. Maybe that's to help with your mental state. I don't know. I would have maybe liked to have been prepared for how bad it would have felt. But to put it lightly, it was the worst I've ever felt.
Yeah.
Initially, when it first was put in, I mostly just felt woozy, felt a little buzzed, like I had gotten laughing gas.
Yeah. I remember at one point you described it as you felt like you had a weighted blanket on your brain.
Yeah, man.
I was like, that's a really, really, I could like vividly imagine that when you said it like that.
That's very well put, me. I didn't remember I said
Good job,
that.
you.
That is exactly how it felt, but also a weighted blanket on your body.
Yeah.
Everything feels slow. Everything feels heavy. And I remember the biggest struggle for me at this point was using the bathroom. And I didn't know why I didn't have a catheter put in right away. My husband told me later on that I refused it. I said that I didn't want to because they hurt. I wish someone had overruled me.
Yeah.
Because going to the bathroom was a really difficult feat because, like I said, you feel woozy, but you also feel sluggish. And I had to drag the IV with me. And I know in your story, you were talking about having to do that. And it's, you're attached to so many cords and walking across the room to the bathroom. And I had to be supervised because they were afraid I might fall.
Right.
And also, again, I'm pregnant. I have to pee all the time.
And they're pumping you with fluid.
Pumping me with fluid. So, I mean, this is like every 15 minutes. By the time I stood up, walked to the bathroom, got back in bed, it was only a couple of more minutes. I had to go again. And so we continued in this manner for 24 hours. And it was really, really terrible as the only way I know how to describe it. I think that had I known the extent of how I would feel on this drug, I would have potentially handled it differently.
Yeah.
And maybe it would still be terrible, but maybe I just would have known.
Yeah.
And I would have advocated for a catheter right away. And I would have advocated for maybe a couple of other things. But, we went on and on. And the goal was to get to a point where my cervix was softened enough to start Pitocin. And so they had to wait 24 hours for the side effect to really take effect. We had started at 5 p.m. And so it was going through 5 p.m. the next day. And at this point, the magnesium had made me so sick.
Yeah.
I was nauseous. I had splitting headache, hard to open my eyes because it was anything too bright. It felt like a migraine. Like, speaking college roommate to college roommate, it felt like the worst hangover I had ever experienced. It was just the worst. And the OB came in around a little before 5 because we had hit the 24-hour mark of the side attack. And it was time to decide what the next step was going to be. And like I said, the plan was for it to be Pitocin. And Pitocin is the drug that really initiates those contractions and the dilation of the cervix to open up and prepare for vaginal birth. And so they did a cervical check on me and I had softened enough to do it. Okay. And so the OB sat down and said, now is the time to decide, do we want to start that Pitocin right now? And the way he described it to me was he said, it will take anywhere from 12 to 24 hours to work. During that time, you will have to remain on this magnesium drip to continue to protect your brain. And this was the point really where the fear of, or not really the fear, but the conversation I had been talking about before, which was I'm not afraid of a C-section. Right. But what I was afraid of was pushing and battling and struggling to try and get to a vaginal birth that I might never reach. Right. And to have a C-section anyway. Yeah. And that was really my fear. And that was what I didn't want. And that was what I was the most clear about.
That was my fear when you were giving us updates. You've gone through this like really tough 24 hours. And then now you're potentially going to have to go through maybe another 24 hours, maybe more, because you weren't in labor at all, going into this whole thing. Right. And then I just kept thinking to myself, like, even if she makes it to complete to 10 centimeters, how is she going to push like when she feels like this? Like, I can't imagine giving birth, like feeling how you were feeling.
Mm-hmm. And I was under such the influence of this magnesium drip that the funniest part to my husband and I was that he was talking to me, maybe having one of the most important conversations of my life.
Yeah.
And I closed my eyes and I said, I'm just resting my eyes, but I promise I'm listening.
Meanwhile, you start softly snoring.
My husband was like,
just resting my eyes.
please focus.
So, I mean, that's another thing too, is I feel like you guys probably would have talked through your options, but pre-starting magnesium drip, had you known.
Yeah. That is my biggest gripe, if you will, is that, you know, I was like, why did I have the most important conversation of my entire pregnancy while under the influence of something that really completely altered my state of being?
Yeah. I can't imagine how hard that was too for your husband to be making this, or feeling like he was having to make those decisions, you know, without you in a fully conscious state.
Yeah. And to be honest, that really did make the decision for us, because realizing that I couldn't even have a decent conversation at that point showed me that there was very little chance I could have a baby vaginally. And, you know, I'll give my OB really great props. I think there's a very big notion out there that OBs push for C-sections. Not mine. In this case, he was very, very highly advocating a vaginal birth. And I think that was largely because, or I know that it was largely because of the size of my baby. I was 34 weeks pregnant at the time. The baby was measuring under 5 pounds. And so he kept saying, my OB kept saying, this isn't a full-term baby you're pushing. Almost half the size of a full-term baby. We're hoping that it will be easier on you. And so he was really advocating for a vaginal birth, largely because of the recovery and also the implications on any future pregnancies that I may have. And I'm sitting here on a magnesium drip saying, don't talk to me about my second pregnancy. I don't care.
Making a lot of assumptions.
I don't care what my next pregnancy looks like right now.
This is now.
But I appreciate that he did.
Yeah, it's very thoughtful.
He was like, you've talked to me about wanting multiple children. I'm just giving you all the facts I can right now. And your easiest recovery will be a vaginal birth. And that will be the most natural thing for your body to do in this instance. And I looked at my husband and I said, will you pick for me? And he said, no, ma'am.
I cannot do that, honey.
He said, I can't do that for you. I'm going to support whatever you decide. And I think in that moment, I was hearing the doctor say, this will be really good for you if you do it vaginally. And I was feeling all this pressure to do it vaginally. And so I said, okay, fine, I'll do it. And my husband looked at me and he goes, don't do it for me or for him. Like, what do you want to do? And I said, I want to have a C-section. And I just blurted it out. I was like, okay, fine. And it was up to me. And I had gone my whole pregnancy being like, they'll tell me. They'll make the decision for me. And I'll just trust whatever they say. I didn't know it was going to come down to me. And it's like, you really are responsible. You become a parent before you become a parent. And I spent that whole pregnancy being like, wow, I'm already a mom having to make these
difficult
decisions. And when it came down to that being my decision, I was like, wow, you know, there's so much about choice for women that, you know, we advocate for, but I was like, can someone pick for me?
I know.
In this instance, it's a lot of pressure, but I do think that I made the right decision. And when I said I want a C-section, I felt this weight lifted because it was just done. I could breathe just knowing that we had a plan and that it was going to work out. And so again, another moment of thinking, you know, we're waiting around. All of a sudden the doctor said, okay, well, I'm going to go see if there's an OR ready and we'll get it going. And he came back in and said, there's a room ready right now, a team ready, but we have to go right now. So then, of course, my husband has to send the update to my family and friends being like, we're having the baby.
Like it's happening. Oh God.
It's happening. So the epidural team comes in and they gave me the epidural. I always feel like this is worth noting because everyone I've told about the position I was in to get the epidural was not one I've heard before, but they raised the bed up very, very high, like a throne. And I was sitting in it, and they had my husband sitting next to the bed on a chair, and I had to put my feet flat on his knees. And that's how they did the epidural. So he was holding my ankles.
Interesting.
And I'm like sitting in a chair basically. And another thing worth noting is that they took me off of the magnesium drip for the surgery. And so at this point, I was starting to feel a little bit better too, because I was feeling sort of like a veil lifting.
Yeah.
But, you know, the epidural was funny too. Again, being in charge of reporting, they were like, "Are you numb?" I was like, I think so, but like, can someone check?
Can someone pinch me?
Yeah,
Or,
you know, you're about to cut me open. I
Yeah.
would really like someone else besides me,
Right.
to be sure. And I knew that I was definitely numb because I kept saying, "Can someone put my knees down?" I thought that I was sitting with my knees up, and they're like, "Your legs are flat."
Yeah.
And they were like, sometimes the sensation of however you were last sitting.
Like a phantom limb sort of thing.
And I was like, "Oh man, I wish I'd known that."
Yeah.
And I put my legs flat when you gave me the shot. I spent the entire surgery thinking my knees were up.
Oh, that's so funny.
It was such a weird feeling.
And because you had a curtain so you couldn't see.
Yeah. So they wheeled me to the OR, and everything's happening warp speed so fast at this point, and it's really kind of scary. And again, I don't want to doomsday anybody who might have a C-section, but it's just, you know, surgery is a big deal, and it's tossed around so much in pregnancy that you're like, "Oh, a C-section, no big deal." But I'm like, this is surgery. This is something that I've never had before, like a major abdominal surgery. And they take me to the operating room and they put a curtain up. And so if I can paint a picture, since we're voices only, there's I'm laying on my back and there's a curtain around my chest height, and it's blocking my view of anything below my chest.
Yeah.
And my husband was up by my head because he said, "I don't want to see that."
The inside. No, that's understandable.
Turns out they don't really give you a choice, and you do end up seeing some stuff. But
you did, or he did, or both?
Both.
Really? I haven't heard that from other people.
Well, it's interesting. You know, the Grey's Anatomy lover in me knows that, you know, they used to call ORs operating theaters.
Right.
And the theatrics of a C-section are real. I mean, curtain and all. You've got this curtain up, and they start the procedure, and it takes some time where they're really cutting through the different layers of fascia and muscle to get to your uterus. They're doing all of this behind a curtain. So really all I could feel at this point was pressure and tugging and pulling, but I felt more than I thought I would feel.
Really?
It's very uncomfortable.
Yeah.
It's the best way I can just really describe it is that it just feels very invasive. You know, there are hands inside of you, and you can feel the tugging and pulling, and it doesn't hurt, but you're wiggling, you're moving, you can hear things. It's not what I expected.
Yeah.
And I don't know what I expected, to be honest, but there were parts of it that were really unpleasant. But then there was this moment. So they said, "All right, we have the collar ready." So there's this collar that they sort of put at the incision site where they can pull the baby through. But they said, "We're going to have to push really hard on your stomach. One big push, and then it will, like, the pressure will force the baby out of this collar." And so they did. They said 1, 2, 3, and they pushed on my stomach, which did not feel great. But then as they did this, they dropped the curtain. And so the curtain drops, and there's this clear film in front of us, but I could see.
Yeah.
And I see them pull my baby out of my stomach.
Gosh.
And like, my husband sees it, I see it, and we're just like, whoa. And so they pull him out, but it's weird because of the collar. It was like very clean looking.
Yeah.
Like, essentially it just looks like he's like coming out of a tunnel.
Yeah.
And so they pull him out, and they put him towards the film, and he reached his little hand out towards mine, and I put my finger against the plastic, and we touched hands, and it was so crazy.
Oh my gosh.
It was like just such an alien
Yeah.
experience. And he looked like a little alien. And then he actually like spit up a little bit of the fluid and it landed on the clear plastic right in front of my face. And it was just like, it was gross and funny
But
and amazing all at
Yeah.
once. And we were just like, oh my gosh, this is crazy. And then they put the curtain back up.
Yeah.
They just close it back up.
That's so interesting. I've never heard someone describe that like the clear curtain and then the opaque one being dropped.
Yeah.
It sounds very dramatic, like you said.
And it was so like choreographed.
Right. And it's like, I did they ask you ahead of time if you wanted to see it?
Nope.
Yeah. I would be like, I don't know. Like, I feel like normally I hear people with C-section, they just hold the baby up above the curtain afterwards or something. But
nope.
Wow. Because you might have seen a lot more than you bargained for.
I did.
Potentially.
I did. And one of the nurses was actually taking some pictures on my husband's phone.
Yeah.
And so we have some somewhere.
I want to see them.
I know. I honestly, I don't look at them as much as I would like to because they're not on my phone.
Yeah.
And I'm like, I should get them to send them to me and I'll definitely show you.
Yes.
But yeah, they did not tell us they were going to be doing that. But it felt so like they do it all the time.
Yeah.
And so they were like, here we go, boom. And it's just this little show almost.
Wow.
So all of this happened. It just like, I mean, keep in mind, this is all like 45 minutes after that conversation in my room.
Wow.
So it was a really fast experience, which then became even faster because as you can all predict, I was 34 weeks pregnant. This is 6 weeks preterm.
Right.
And so they had warned me that my son would have to go to the NICU.
Yeah.
At least initially to be checked out and for an undetermined amount of time.
Mm-hmm. So did they bring him to your face or anything?
They did. They brought him to my face and they then brought him over to the side in this little bed area to do the normal check, the bedside heart rate and cleaning and things like that. But then they said, all right, we need to take him to the NICU. Dad's going to go with the baby and we're going to finish your surgery. Yeah. And so there was a period of time where I was alone in the operating room and it was weird.
Yeah.
You mentioned this in your story before, but like when you're alone for those moments after you have a baby, you're like, did that just happen?
Right. It's very surreal. It's like, was that a dream? I don't,
And you almost feel a little like a shell, like a used husk.
Yes, totally. A
Where
little
you're
let down, a little bit like, well, I guess I've served my purpose.
Yeah. I was like, all right, I guess I'm just here now. So yeah, they stitched me up and I can't remember exactly how long it took. I was just in such a daze at this point. But then they also said, now we have to put you back on the magnesium. Preeclampsia post-birth is actually the most common risk zone. Yeah. People can have intense bleeding after birth, and that's just really when a lot of that risk takes place. So I think that in most cases with preeclampsia, you're almost guaranteed to have to be on the magnesium drip after. But it's not always guaranteed that you're going to have it before. This is important to the story because I had to be wheeled to recovery and then to my postpartum room to be on that magnesium drip for 24 hours. And because I needed to be there and my son needed to be in the NICU, that meant there's 24 hours after he was born where I couldn't see him. And, it's probably the point of this whole thing that makes me the most emotional because I just didn't prepare for that. Yeah. Emotionally. And granted, I was super out of it. You heard me describe how I was on magnesium. It was the same after. Yeah. But then there's also these weird symptoms of body shakes that you get after birth.
After epidural.
After epidural, it was like your body just like feels like you're trembling, like you're the coldest you've ever been, but you're not cold. Yeah. And I was tired. I was really out of it. So it wouldn't have been a time I'd want to be with my baby, but also it just, again, that feeling that I had laying on the operating table was extended. It just, you just really feel for 24 hours, like what just happened? Yeah. And, you go through all of this and you think you're going to get a baby at the end of it. Yeah. And I can't even begin to try to empathize with how somebody who's had a stillbirth could feel.
Mm-hmm.
But I imagine it's something like this, but amplified
Yeah.
because you just feel like I was supposed to get a baby.
Right.
And it was really hard. And that first 24 hours was just me sitting in the postpartum room, and I had some visitors. Family came by to check on me, and visitors were also able to go visit my son, which I will say his name is Cameron.
Mm-hmm.
And we were able to have people go with my husband to go visit Cameron and see him. But my sweet husband, Carter, I didn't know he was going to do this, and we didn't discuss it at all because obviously we didn't know any of this was going to happen. He didn't let anybody, including him, hold Cameron for that 24 hours. He said, no one is going to hold him before his mom. And it makes me so emotional because, like, I didn't ask him to do that. And to be honest, I didn't even know that he had decided that. I thought no one was allowed to.
Yeah.
I thought that Cameron was too small and that he was hooked up to all these machines and that he couldn't be held. Yeah. I didn't know it was that Carter had told everybody that I got to be first, which is just, everybody make sure you marry the right person before you have a baby, because
it doesn't get easier.
And when you're with someone who truly gets it and gets you and is looking out for you, it's really amazing. And so that was so special. So, man, I really counted down the minutes until I could be off of the magnesium. But I mean, I think it was like 1 a.m. when I finally was able to get up to the NICU. And luckily it's a 24-hour visitors for parents. Parents can go in anytime for as long as they want. And so we went in and I held him for the first time, like 26 hours later. From then on, it was really just a journey of healing, of getting myself healed and getting Cameron, I won't say healed because he wasn't injured. He was actually a beautiful, healthy baby. He was born 4 pounds, 14 ounces. And the chief concern for him at this point was his weight, his size. He was just little. And he had some breathing issues, which all preemies have, because like I said, the lungs are the last to develop. And so learning how to breathe on his own was something that was just needed time. Yeah. And so really his entire NICU stay, which was 25 days, his entire NICU stay was focused on breathing and eating on his own. Yeah. And we were really reassured from the get-go that he would graduate. Yeah. It was just going to take some time. Yeah. And for the first few days, it was really fine for me that he was there because I was in the hospital. Right. It really didn't hit home how hard NICU life was until I got discharged. Yeah. And, going home without your baby is another one of those gut punch moments. It's not
natural. Yeah.
I was supposed to get a baby. Yeah. I was supposed to do all of this work and get a baby. And, he's a human being. He's not a prize, but it sort of feels like one.
Yeah.
And, spending nights at home pumping alone, or really, really hard, dark moments. And, going to and from the hospital, visiting him when I'm supposed to be at home recovering from major surgery was hard too. And to be honest, I think it was a major factor in why I ended up actually getting readmitted to the hospital. So a few days before I was supposed to have a check at my OB, I think it was my 2-week check. I actually don't remember how many weeks it had been. I didn't feel good. And I was at home. We had visited Cameron earlier in the day and I'd felt fine then, but I was laying on the couch at home and I just felt sick. Yeah. I felt all over body aches and feverish, and I just did not feel good. And I knew I was supposed to be going to the doctor the next day, but again, in that moment, I was like, I have to advocate for myself. And I told my husband, I said, we need to call the doctor. Yeah. Something doesn't feel right. Yeah. And I told them I had a fever and they said, you need to go to the ER. Yeah. So we went to the ER, and it turns out I had developed an infection in my uterus. It's called endometritis, and not to be confused with endometriosis,
Right.
which I definitely got that confused a couple of times in the hospital. But essentially, when you have a C-section, even as sterile as hospitals can be,
Yeah.
your body is open to the air, and there are people in the room, and infection can get in. And then also, I was going to and from the hospital for days and days, not resting.
Right.
And going in, hospitals are not always the
Clean.
cleanest
Yeah.
places. And yeah, so at some point along the way, I picked up this infection, and I had to be readmitted to the hospital for a few days. And I was super excited because I thought, well, cool, I get to be under the same roof as my son again. It wasn't that easy. I couldn't leave my room a lot because I was sick.
Right.
And they had to rule out anything else that I might have been sick with because I'd been on the outside, and having a fever and holding a preemie is dangerous.
Yeah.
So that was another really emotional roadblock
Yeah.
from this experience. But I was on antibiotics for a few days, and I was able to go home again without Cameron, which was hard to do it a second time. But
I mean, thank goodness too that you listened to your gut, because those uterine infections can be really serious.
Yeah.
Really serious.
And again, people say it's like childbirth. People used to die every day in childbirth.
Yeah.
And I'm like, oh, it's 2025. It's fine. And I've had a couple of brushes, if you will, and I don't want to be dramatic. But, from the ectopic pregnancy, they were saying if this ruptures, you could bleed out and die. And then, the preeclampsia, you could have a stroke and die. And the uterine infection, all these things. I'm like, this is some scary business.
Chris and I have talked about that a lot. That's something that I didn't really think about as much until he brought it up when I was pregnant the first time. He was legitimately scared. He was like, this can be life or death. And I think because people give birth every day, all the time, we don't think about it as much. And I think because you have to focus on the good, right? Otherwise people wouldn't keep having babies.
Yep.
But yeah, it's very real. I mean, it's, you're risking your life when you're pregnant.
Yeah.
I also think like surrogates are just angels on earth.
And talk about leaving the hospital and you don't get the prize of the baby. It's like they're otherworldly women. And also, speaking of otherworldly women, is donor breast milk.
Oh yeah.
My milk obviously hadn't come in because, again, my body was not ready
and
to
then
have
you were
a baby.
Separated from him too. So like, not only did you give birth sooner than your body was in the process, but then, so much about getting the milk to come in the early days, so much of that is the contact of like your baby, and you were separated.
Yeah. And so my body wasn't ready. I also didn't have vaginal birth. So all the signals that your brain gets, they weren't happening. And Cameron, babies, I didn't realize that babies can't handle formula before 36 weeks gestationally. And so he was born at 34 weeks. So for those 2 weeks, he couldn't have formula. He had to have breast milk, and I didn't have any to give. I was producing drops of colostrum, that was funny. I was able to express some colostrum into a tiny little jar that my husband sprinted up to the NICU and was able to put a cotton swab of it into his mouth. And it was like the coolest thing ever. We were like, amazing. Look at what we did.
I know.
And now I'm like, it was a drop.
But it still made a difference.
It did. But yeah, the women who donate breast milk, thank you to them, because they fed my son for 2 weeks until he was able to be on a combination of formula and my breast milk, because by then I was able to produce enough to supplement the formula he was getting, which was really cool. Yeah. And you said this a second ago, and I just think it's a funny way to, round out this conversation, is that the things that we go through to have a baby and to bring babies into this world, the way anyone has multiple babies, I have no idea. I say I have no idea, but girls already thinking about it.
Yeah.
I'm like,
for a second, I thought you were going to tell me you were pregnant.
Oh
I
my
was
God.
sitting here like, oh my God.
What if that was
that would be a way.
If that was my announcement right now.
Oh my God.
Wow. No.
I was like, my heart stopped for a second.
No, not that. But I get it.
Yeah.
I'm like, I'm already like, even 13 weeks after, I'm like,
Yeah.
it wasn't that bad. I can do it again. And
Oh.
I will say, for some hope about my story too, with everything that I went through, I know so much now.
Yeah.
And the odds of me having preeclampsia again are there.
Mm-hmm.
They're almost guaranteed. But one of the cool things is that it's almost guaranteed to be not as bad, because if I have another baby with my husband, which I would plan to do,
Yeah.
my body is familiar with the cells that his DNA and my DNA coming create together in the placenta.
Yeah.
It's no longer foreign
Mm-hmm.
to my body. And so my body will build another placenta and say, hey, we recognize this, and they will be better to fight it, just like almost like the way a vaccine works.
Yeah.
It's given my body that knowledge. And so that will be better. We're working on ways now to help my blood pressure with medication so that when I do get pregnant again, if I do get pregnant again, all of those things will just be so much more manageable, and we'll know about it. And I'll also just have so many more options around labor and birth. I will have the option of skipping the Cytotec 24 hours and Pitocin. I will have the option to just go straight to C-section if I want it. I don't know that I want it. You know, VBACs are dangerous in some ways, but they're also possible and doable.
There are pros and cons to both.
And the recovery from a C-section is no cakewalk. And I'm not saying that I think the recovery from a vaginal birth is a cakewalk, but being that I would have a toddler at the time of doing it, I think it's something worth exploring. So the one thing I will say, who knows what will happen next, but I did change my perspective on just learning what all there is to learn, because you are your biggest advocate in this instance. And it's life or death, and you're out there fighting for yourself. And you have a support team. Hopefully you have great doctors and you have great midwives and your partner, but you are in it.
Yeah. You're fighting for yourself and for your baby.
Yeah.
I always say knowledge is power.
Yeah. And, you know, I used to say ignorance is bliss. And I think that there's a happy medium in there.
Yes, I agree. Well, I always like to end by asking you to describe birth in 3 words.
Oh, wow. I will say, you know, I don't know why this word is the first word that comes to my mind, but cool. I felt so cool. I was like, my body made a person.
It is really freaking cool.
And it's surviving removing that person. Like, however the baby comes out, it's like, I did that.
You grew a whole nother organ. Like it's wild.
Yeah. So cool. It's a very simple word. You know, unfortunately, I would say one word would be scary. And I think that it's worth mentioning, because I think if you know that going in, you can prepare for ways to not be scared.
Right.
And I will be less scared next time, because I'll know. I won't be so uncertain about what's going to happen. And granted, I could have a completely different thing happen next time. Who knows? But, you know, having my first birth be scary, I'm prepared now. And then my third word, I think that my third word, I would have to just say beautiful, because I made a baby with the person I love the most in this world. And he looks like us and he smiles at us. And even in that first moment when he came out, and he was so beautiful, and, you know, luckily he had that C-section face.
Not smooshed at all.
He's all perfect and pristine. And even in his little teeny tiny self, he was just so beautiful. And, you know, I wouldn't have thought that. You know, it's surgery, it's scary. There's so many things about it, but even in the midst of all of that, there was so much beauty, and it was just cool to see.
I love that. Well, thank you so much for being here, for talking to me, for sharing your experience. It means so much. I know it'll help other people.
Yeah, I'm happy to share it. Thank you. Thanks for having me.
Of course. And we'll have to pre-book you for the next one.
Oh, at least it's not right now.
Yes. Until then, you've been listening to the Arrivals podcast. I'm your host, Merelise Wilson.